Okay, hello everyone. I'm Elizabeth Landine with the National Environmental Health Association. Thank you for joining us today for the Wonderful World of Edibles, Are They Safe webinar. Marijuana usage is growing in acceptability across the country, and with the changing regulations in many states, legalizing its use both recreationally and for medicinal purposes. While these are exciting times for many, they raise questions about the safety of these products and how should it be regulated and inspected. This informative webinar will explore the world of edibles. Edibles are produced for both medicinal and recreational use and consumed in communities many local and state food safety agencies serve and protect. You will hear from 3 speakers today. Our first presentation will describe environmental public health considerations when evaluating these marijuana products for levels of cannabinoids, as well as environmental contaminants such as heavy metals, pesticides, residual solvents, and microbial growth. The second presentation shares a recent marijuana edibles recall and the challenges that the regulatory system experienced during this highly charged food recall. And the third presentation will cover preventive controls and best practices that edible producers can put in place to minimize food safety risks and keep consumers safe, and also aid regulators tasked with enforcing regulations in food safety. A bit of housekeeping before we get started. All webinar participants will be in listen-only mode. This webinar is being recorded. If you're not okay with this being recorded, you can disconnect at this time. Also, there will be a question and answer at the end of the presentation, so we'll hold all questions until then. Q&A will be conducted via the webinar chat box, so feel free to enter in any questions that you have via the chat box throughout the webinar, and we'll address the questions at the end of the presentations. So with that, we have a great lineup of speakers today, and to ensure we have enough time at the end of the webinar to get to all your questions, we'll go ahead and get started. Our first speaker today is Marc Nascarella. Dr. Nascarella is the Chief Toxicologist and Director of the Environmental Toxicology Program at the Massachusetts Department of Public Health. Dr. Nascarella serves as the Senior Science Advisor to the Massachusetts Medical Use of Marijuana Program and directs staff activity related to marijuana product surveillance, patient safety, and regulatory translational science research. Dr. Nascarella, I'll go ahead and turn it over to you. Marc, are you there? You might be on mute. Oh, hold on. Let's see. Give me 1 minute. Let's see. Marlene, are you on the line?
I sure am.
Okay.
Can you hear me?
Marc might have dropped off. I know he had an audio issue earlier that booted him off, so maybe we'll go ahead and jump to yours. So hold on.
I am ready. You want to move to my first slide, please?
I do. Give me 1 second.
Slide 23 there. Yeah.
Okay, hold on 1 second. Let me give you an introduction. Okay, so we'll go ahead and start with Marlene Gaither. Marlene is the Environmental Health Program Manager with the Coconino County Public Health Services District, and Marlene has worked in the environmental health profession for the past 37 years, currently for Coconino County Health District in Arizona, and prior to that, Sanders County Health in Montana. Presently, she teaches courses at Northern Arizona University in both epidemiology and environmental science. And her education background includes 2 masters in environmental engineering and public administration with an emphasis in health from Northern Arizona University. So I'll go ahead and turn it over to you, Marlene.
Good morning, everyone. Thank you for inviting me this morning. And so my presentation is about the medical marijuana recall that we had. But I'm going to start with just a little bit of a background about how did Arizona get involved with in medical marijuana. So it was after the elections, and then in 2010, the Arizona Department of Health Services then adopted a law that would enact and enforce rules and regulations for dispensaries, for the processing of medical marijuana, and for the sale of this. And so it was also in 2011 that Coconino County then at the same time adopted an ordinance for edibles, or we call them medibles, medical marijuana edibles, and that is actually part of our food code. And so then shortly after that, there were all kinds of questions, more questions than before, involved in this process. And so we had applied for a grant with the Arizona Department of Health Services so we could start doing research on the processing, packaging, and labeling of medibles. Okay. And so who regulates medibles in Arizona? So we have this Arizona Department of Health Services, and it's actually the Division of Special Licensing that oversees the licensing of the dispensaries and also the issuance of the medical cards for clients. And so, and of course, medibles are on the rise. And so we've seen a 20 to 25% increase in the total sales just in the last few years for medibles. Okay. And so for us, the first thing was, well, what goes into a medible? And we had no idea. We knew that they had the THC, the tetrahydrocannabinol, and also the cannabidiols, the CBDs. And so we were looking at, so these dispensaries could make all kinds of medibles. They could be potentially hazardous, or TCSs, or they could be non-potentially hazardous foods. And so we didn't really realize how do you actually get the THC and the CBDs into these foods. And so we looked at this, and of course, originally we thought, well, they just grind up the plant and they cook that into the plant. And actually the state code requires that there be actually plant material in the medibles. But further investigation showed that they don't use the buds from the plant. Those buds are sold for other purposes at the dispensaries. And so they actually use the trim, and it's called sugar leaves. And so it's the little leaves that grow underneath the buds that actually where the resin drizzles on those leaves. And so they spend many hours trimming those little leaves off, and that's what they use to extract the THC and the CBDs. And so common extraction methods, most of you have probably heard of butter, and that's where you actually just put the plant material in there and cook it with actual butter to extract some of the active ingredients, but that only gets maybe about 40–50% of the active ingredients. And so then other dispensaries started looking towards CO2 units, and butane, it was a very commonly used extractant material, and also alcohol now. And we've got another one that we just saw a couple of months ago at one of our dispensaries that I'll share with you. But in this picture, what you're looking at is actually an alcohol extraction unit. And so what they do is they actually will run alcohol, a very high percentage proof alcohol, through the trim leaves, and then they actually then remove the alcohol back out. Because in Arizona, you cannot have two substances in any extractant. So you can't have alcohol and THC. So you have to have the alcohol removed. And so this is the newest extraction unit that we saw, and it's actually called press extraction. It uses no type of chemical whatsoever, and it adds heat to the press, and they put the trim leaves in there and they press out the active ingredients, as you see kind of on the right-hand part of the slide, the extraction. And so our medical marijuana recall started with a routine inspection of a dispensary where inspectors noticed that there were jarred goods sitting on a shelf at room temperature, and they were various savory type items that looked like they could be TCSs or potentially hazardous foods. And so the dispensary had not contacted us because we do license and inspect dispensaries here in Coconino County. And so they hadn't gone through any process controls to determine whether these are potentially hazardous foods and what the shelf stability is or anything like that. So it looked like we had a real problem on our hands, and we wanted to make sure people didn't get sick. so processed at the dispensary kitchen, we had, what they did was they took the extraction and they would add it to the food after it was processed, and then the mixture was added to the jars cold, so there was no heat treatment after that. The lids added, no heat processing, and then stored at room temperature, and then again they had no pH testing or water activity testing. And so distribution of these savory products were throughout Arizona at the other dispensaries. So we had 33 other dispensaries that received these products, and then 22 different cities. And so what do? We have these jarred canned goods, possibly potentially hazardous foods, that also had these active ingredients, THCs, which are Schedule I drug regulated. And so we could not embargo these, so we started asking around, how do we start this process? And so who implements, who would actually oversee the embargo, how would we notify the users, the dispensaries? And so we started checking around. And so we started with our state partners, and then we also looked to federal agencies for how do you conduct a voluntary recall. So we actually used FDA's outline for a voluntary recall. And so with special licensing, who administers the rules, they helped us developing the public service announcement that went out to all the clients who received this, and then to all the dispensaries. And so we drafted a consumer service announcement with our state partner that was sent out to everyone. And of course, we then contacted the dispensary itself who made these products, and they were more than willing to recall the products. And so the type of products that were made, marinara sauce, they have some really cute names for them, which is marinara sauce, high-end spicy ketchup, pot wing sauce, and funny mustard, as you can see by the labels here. So announcement to cardholders, do not consume the products, where to return the products, and patients were reimbursed by the dispensary who actually made or processed these items. So coordination with the dispensary included that they agreed to recall all the products in question. They provided a list of all the products that were distributed. They provided a list of dispensaries that received the products. They also had a list of foods that each dispensary received. Also posted an announcement on their website to help with this recall. So this shows you some pictures of the product that was actually destructed and destroyed. So you have to go through certain steps, because you do have these active ingredients in there that are regulated. And so they had to follow all the steps, which the special licensing department with ADHS oversaw. So the total recall included 134 jars of marinara sauce, 138 jars of the pot wing hot sauce, 100 jars of the funny mustard, and 70 jars of the high-end spicy ketchup. So conclusions. The recall process was successful. It went more smoothly than anticipated. No illnesses occurred. The dispensary recall steps are now in place, so we've saved these. Dispensary submitted a HACCP plan to us, health district, so that we can go over each recipe. We're reviewing how the process is occurring. They're having a food lab test the actual food before it receives the active ingredients to see if it is a potentially hazardous food. And they're actually going through lab testing for shelf stability. And here's our special acknowledgments, especially to the state and everyone with the county health district that helped. And that concludes my presentation.
Great.
Elizabeth,
Thank you,
I'm going to hand it back over to you. Thank you.
Wonderful. Thank you. I'm going to ask everyone to just sit tight for 1 minute. We've got some awesome questions coming in already. And Mark is, I think, sitting on the speaker line and can't get transferred over. So I just want to try to get him transferred over. If not, we'll move on to Cindy's presentation. But just give me 1 minute. All right. Cindy, are you there?
I am here, yes.
Okay. And Mark, are you there?
I am.
Great. Okay, Mark, let me get your slides set up, and we'll go ahead and move on to yours. I've already given Mark an introduction, so we'll
Great.
move into Mark's slides. Okay, Mark, there you go.
Okay, great. And so now I'll tell this story in forward order. You've just seen it in reverse order, and pardon the technical delays, but we'll jump right into it. What I'd like to cover today is a little bit of a conceptual model of exposure and how we think about marijuana here in the Commonwealth of Massachusetts. Until recently, the discussions in Massachusetts have only been with respect to medical marijuana. So our experiences here with regulating this industry really relate to medical marijuana. We will have a recreational marijuana industry next July. So a lot of these data that I'm describing here we will use to inform or recommend how that market should be regulated by another state entity. We'll also talk about the commercial production of marijuana in Massachusetts in the medical space and what we do to surveil the product in terms of how we test it in the laboratory, some of our product surveillance results, looking at contaminants of concern, and how we seek to track all of this information. And then I'll give you a bit of an overview of the programmatic medical use of marijuana program. I know many of you are from local health departments or from entities that would be really interested in how our medical use of marijuana program operates in terms of compliance and enforcement activities. I will say that I am in a separate organization. We work collaboratively, and I support that entity, but it is a different entity in Massachusetts that regulates medical marijuana. So when I say conceptual model, what I'm referring to is how we think about potential exposure to contaminants from marijuana. As many of you might intuitively think, a marijuana plant has the ability to accumulate different levels of contaminants. Contaminants may be applied directly to the plant, so think pesticides that are applied topically to the plant. The plant, of course, is growing in non-sterile conditions, so microbial contamination is always present to the extent it's pathogens. It's something we test for. The grow media that the marijuana is grown in may contain low levels of arsenic, cadmium, lead, and mercury. And the marijuana plant, by virtue of its evolution, has evolved this ability to accumulate relatively low levels of contaminants that may be in soil into the plant tissue. So in Massachusetts, we look at levels in both the grow media and the plant to account for that phenomena. So a quick primer on commercial marijuana production, and I realize that you may have just been giving something similar, so I'll kind of fly through this. But we tend to think of marijuana in different buckets, and the buckets can be described as kind of cultivation, harvest, processing, packaging, and retail sale. So this is a similar slide that you might see if we were talking about any other agricultural commodity, and I think that's helpful for us as regulators as we think about the inputs into this system and where contamination may occur. So within the cultivation phase, there's the potential for pesticides and heavy metals to be introduced into the product. From harvesting, there's the potential for introduction of microbial contamination, either from the environment or from the handling. Certainly with processing, there's the potential for some of these residual solvents to be present when marijuana oils are produced from the plant material itself. And then there's a fair amount of handling when that product has been packaging. So there's always the potential for microbial contamination from enterobacteria or other, improper sanitary techniques. And then within the retail space, again, that introduces another opportunity for potential contamination. So in Massachusetts, we surveil the product to understand this. So the testing in Massachusetts of that product is performed by private laboratories. These are not local, regional, or state laboratories, but rather private laboratories that must be accredited by industry ISO standards, and then they're evaluated for kind of a third-party standard. We tend to describe this model as being something similar to how drinking water is regulated, in that there are private contract laboratories that support that testing, and then they're describing those results back to the drinking water regulators in support of U.S. Environmental Protection Agency regulations. Within Massachusetts, we test the grow media and samples of all retail products, and we evaluate those results as compared to industry standards for really food and drugs. So we compare the marijuana product to the same set of criteria that would be applied to medical devices or pharmaceutical preparations. And we'll talk about that in a few minutes. And this testing in Massachusetts is required per statute and regulation to ensure patient safety, and it mandates certain product labeling requirements. So because we mandate that certain items must be described on the label must describe that the product is tested, and it must describe that it has a certain cannabinoid content. We use laboratories to ensure that information. So a quick snapshot of our testing. In about July or August of this year, we will have been testing with fully operational laboratories for about 2 years. So we will have about 2 years worth of testing data. If we look at state fiscal year in 2016, in Massachusetts, and the state fiscal year in our state runs from July 1st to June 30th. So state fiscal year of 2016, there were 5 registered marijuana dispensaries, and there were 2 laboratories supporting those results. We received 2,000 laboratory reports describing 1,800 samples. And a little later on, I'll describe the difference between what might be on a report and what might be classified as a sample. This year, through August 2017, we now have 8 RMDs. By April, we actually have 10 as of today, and we have 3 laboratories as of April, and today, again, we have 4 laboratories with more coming on. We have 2,800 laboratory reports and 2,600 samples. In essence, what that means for us is we are processing about 400 laboratory reports each month, 100 a week. Essentially, staff here, toxicologists, will review those lab reports, enter them into a relational retrieval database where we look at trends and try to understand what this product looks like. In terms of an aggregate description of the product in Massachusetts, we see that about half the product tested is flower, about 30% is marijuana concentrates, and about 15% of those laboratory reports are marijuana-infused products, so your brownies, cookies, those kind of edibles, as well as the non-edible preparations like lotions and tinctures and things like that. Gives you an idea of the types of products you might encounter in jurisdictions where marijuana is new. I'd say in state fiscal year 17, the results are quantitatively similar. These RMDs tend to have a portfolio of offerings that is about half flower products, and then the rest are split between concentrates directly, so oil that is dispensed directly to the consumer or placed in vape pen cartridges for them to vaporize, or prepared in these marijuana-infused products. So a little bit on our results. The heavy metals that are tested in our products, in state fiscal year, we've tested about 985. Last year, we saw that about 25% of the samples would not pass. They did not meet our requirements for heavy metals. The product was accumulating heavy metals as described in the lab reports, we were able to use that information to do some outreach, explain some change in business operations, talk to the laboratories about developing additional capabilities to measure these analytes. And now this year we see that most of the product passes our heavy metal standards, although we still see about 5% of the products do not pass. So for one of the analytes, cadmium, lead, mercury, or arsenic, those levels will exceed health-based reference levels. In terms of pesticides, we test about 730 products this year. They have all tested as not having any known pesticides of abuse, and we test about 17 of them. An important caveat here in Massachusetts, we do not allow pesticides to be applied to the product. So if you're growing marijuana in Massachusetts for medical purposes, you're not allowed to use any pesticide on the product, and we use this kind of testing to ensure that some of the most potent pesticides that we're aware of aren't present on the product. We also maintain a compliance and inspection program that seeks to inspect the RMDs to ensure that in practice they're not applying pesticides that we're not aware of. In terms of residual solvent testing, we've tested this year about 600 different products, and about 25% of those products fail for levels of residual solvents that are still present in the product that are above levels that we would consider safe. In terms of microbes, about 20% of the products have microbial contamination. That might be expected. So if we did surveillance in any part of the country on retail establishments, we might expect to find some microbial contamination on some of the products. Any environment is certainly not sterile, and we see that the microbial populations or that the microbial results can be related to seasonal fluctuations in some of the pathogen populations. In terms of how do some of these exceedances relate to other maybe similar agricultural products, I want to describe to you how they compare to, say, sampling of leafy green vegetables that the Food and Drug Administration might do, or root crops that you might find in a supermarket. As compared to, say, leafy greens or root crops, marijuana flower, the highest level of arsenic that we have found has been 1,300 micrograms per kilogram. You might expect to find high levels on the order of about 45 in these other agricultural commodities. We think the safe level is 200 micrograms per kilogram. So you can see in terms of our market-based surveillance of marijuana, it is unique in that regard, as it has the potential to accumulate some of these metals in a manner that is inconsistent with other produce. Same is true of cadmium, and certainly the same is true of lead. We've seen marijuana flower that accumulates lead in a manner that is really inconsistent with the high levels that you'd see in leafy green vegetables or root crops. The same is true of mercury. Actually, it's exceedingly rare to find mercury in any plants. Our laboratory reports suggest that it has been detected at levels that are close to our limits in marijuana flower, and certainly the concentrate are approaching those limits and slightly exceed it. So it has the potential to be present, and again, that is a fairly rare observation. You will not find many datum within the FDA reports that describe mercury in plants. So it's important to keep in mind routes of exposure when talking about marijuana infusibles. When we look at routes of exposure, there are certain ones that are more, say, toxicologically relevant than others. There are routes of exposure like dermal application of lotions or salves, where you're applying some kind of a cream to the outside of your skin. Assuming that you're applying it to the outside of your skin and you have intact skin and not some kind of a laceration, that we expect to have very limited effects from that. We would expect that that type of exposure is not all that likely to lead in significant physiological effects. It's not likely to do much to you. That's different than smoking marijuana, dried marijuana flower, like a marijuana cigarette or joint. That route of exposure has a rapid onset. So almost immediately upon smoking a marijuana joint, the user is able to immediately experience that, and they'll begin to change their behavior to modulate that. It's called titration. So they begin to feel high, and they'll stop puffing. And that's an important distinction to keep in mind when you think about edibles. Someone that consumes an edible and is expecting to experience an effect like they do when they smoke will be surprised. That's because a marijuana edible presents those feelings at some time after ingestion, sometimes as quickly as 30 minutes, but sometimes as long as 4 hours. That has significant implications when consuming the edibles because an individual that doesn't immediately experience it may have the potential to consume more of the edible, and by the time they begin to experience that effect, they have consumed a fair amount of marijuana. In terms of some of our testing results, I want to quickly go through some of these results and show you some of the pesticides that we're testing. Again, we test a panel of about 17 different pesticides. Pesticides are important to evaluate because they have the potential to harm the nervous system, kidneys, liver, immune system. As we think about pesticides, it's important to think that these are agents or chemicals that have been specifically designed to kill things, plants, sometimes vertebrate animals like rats or mice, and sometimes flies or other pests. So these are inherently dangerous chemicals, and it's important to test for them. Residual solvents, these are manufacturing tools that you saw in earlier presentation that are used to extract some of the oils from the plant. We test for the presence of residual levels that are left behind in the product after it's manufactured. Butane is an extraction solvent that's highly desirable by the patient and recreational consumer. It's perceived to have an effect on the marijuana that extracts some of the very desirable cannabinoids. So the consumers really demand products that have been produced through butane extraction. So butane, in fact, in our testing, is an analyte where we see a fair amount of samples fail for levels of butane that exceed our standard. I think that's somewhat a product of the fact that a fair amount of cannabis concentrates are produced using butane extractions. In general, we see that microbial contamination is around 20% of the samples fail, or 85% of the samples pass. We test for mycotoxins in the laboratories by some fairly sophisticated HPLC methodology, as well as some assay kits. Microbial contaminants are tested through ELISA, or most probable member colony counts. In general, we don't see products fail because of E. coli or salmonella or some of the toxins. Products that are failing because of yeast and mold that is very related to the season. With regard to cannabinoids, there's, as many of you likely know, there's a number of different cannabinoids in addition to THC that are present in marijuana products. Some estimates state that there's about 420 different products, chemical compounds, 60 of them may be cannabinoids. Each one of these is potentially potent, able to exert an effect either by itself or in combination with other cannabinoids. We see that typically with the medical marijuana in Massachusetts, that the marijuana cigarettes have THC that's approximately approximately 20% THC in these cigarettes. To give you a kind of frame of reference, if you were to order a marijuana cigarette from the federal government to do some substance abuse testing, what the federal government says is a really potent marijuana cigarette would be about 7% THC. So some of these products are about 3 times more potent than the types of cannabis and marijuana that are used in federal studies. I think that's an important benchmark to think about as you're comparing the kind of marijuana in your jurisdiction to other jurisdictions' marijuana or other studies of marijuana. So a quick primer on some commercial marijuana product testing. I know when I first started thinking about marijuana testing, I thought of it as, well, for each product that's available in the retail space, there will be a corresponding laboratory report that describes that product. And I'd say that's not entirely true, and it's very complicated to track all of this information. Give you an example here, where on the left we have a dried flower product, and all the way to the right you have a chocolate that's been infused with marijuana oils and sold as a marijuana-infused product. By the time that product is dispensed, it may have associated with it up to 6 laboratory reports. And I'll quickly walk you through why that may be. The initial product that was available in the retail space was tested for CP or cannabinoid profile, heavy metals, pesticides, and plant growth regulators, as well as microbial toxins. You'll see that the microbials have failed that individual test. So that product is retested. It's essentially remediated. The microbial contamination is removed. It's retested. It's passed. And now it's evaluated as a concentrate. So let's say that concentrate fails because it has butane levels that exceed our standard. So that product would have to be remediated and potentially retested. So by that point, that product has 4 laboratory tests. And if that concentrate is then used in an infused product, it must be tested again. So you could see how this kind of lineage of testing creates an enormous amount of data that's very difficult to track, and you very quickly lose track of the number of samples versus the number of products. And I think in terms of a compliance perspective, it's very important to keep track of that for your inspectors that are on the ground that are trying to tie an individual laboratory report to an individual product and then walk it backwards to what plant in a particular dispensary was used to produce that product, for the potential purposes of determining a recall. I'd say this is not an insignificant effort, and it is perhaps the aspect of marijuana regulation that I least appreciated before we began on this endeavor. So we've developed a tool to help track that. This is a bit of a shameless plug for that tool. My colleagues Logan Bailey and Rachel Wilson recently presented this at the APHL meeting earlier this week, and it's been prepared in a poster. And we do have that available as a PDF. There is an email address on here, mjtalks@state.ma.us. If you send an email to that address, we'd be happy to send that out to you. It's a model of how we would track that information using standardized laboratory report format, and then how that might be worked into an information technology system that would speak to the laboratory information management system, the LIMS reports, the pieces of equipment that report out the levels in the equipment, also speak to the RMDs that are tracking this information, and most importantly, speak to the regulators and the inspectors that have to account for all of this information. So a quick overview, as I promised, of the medical marijuana program. That is a functionally different organization here in the Department of Public Health that's directed by my colleague Brian Harder. And at DPH, it sits within our Bureau of Healthcare Safety and Quality, and it's really organized into 4 primary units: a support center with a call center and a fairly elaborate network of responding to calls and inquiries from the public, which is really important, as you'll see in a minute. RMD applications, so a process of legal review for the regulated community to apply for the ability to have retail sale of marijuana. There's a compliance unit, so I suspect amongst this audience, this is the area that's most familiar to all of us, is how that is enforced in terms of both in compliance of public safety, kind of legal requirements, and health-based inspections. And then there's a data quality improvement kind of an analysis shop. So the medical use of marijuana program in Massachusetts is a vertically integrated market. And what that means is the supplier or cultivator is also the retail seller. And that's an important distinction when you're, I guess, comparing between jurisdictions. I like to say if you know about one medical marijuana program or one marijuana program, you really know one marijuana program. So it's tough to compare any state or any jurisdiction to other states or jurisdictions. The product in Massachusetts is tracked from seed to sale, and that's done using software tracking that allows real-time updates. It also allows updates of the certification and registration of patients that have access to that material. That online system grants 24/7 access for law enforcement, and it allows us to track RMDs and patient distribution. It also has the required security and access controls to protect confidential information. The compliance team at DPH consists of 5 compliance officers, 2 compliance investigators, and a director of compliance. Generally speaking, these are composed of folks with experience in federal law enforcement and the regulation of drugs, experience with local law enforcement, and experience with environmental and public health inspections. Once an RMD is registered in Massachusetts, the DPH compliance teams begin ongoing and unannounced and announced inspections. They are both health and public safety related focused. So data on this program, if you're interested, is all publicly available at the link below. They put out monthly dashboards that describe the amount of product and the amount of patients that are being dispensed. This is available through a DPH website. And I want to quickly acknowledge here, and again, with apologies for the technical difficulties, I have no financial interest or relationships to disclose with any of the RFDs or the laboratories described here. And all the laboratory analysis described in this presentation is the result of analysis by private analytical testing laboratories described here. So thank you, Elizabeth. I think I'll turn it back over to you.
Great. Thank you, Mark. That was really, really a great presentation, and the amount of questions we've received during your time is quite a lot. So I'm going to go ahead and turn it over to Cindy at this point. Let me give you a little introduction on Cindy. So Cindy's our next and final speaker. Cindy Rice is a certified HACCP manager, ServSafe educator, and SQF consultant for the food industry, assisting food processors in achieving certification for GFSI and FSMA compliance. She's the president of Eastern Food Safety and is also the food safety expert for Ecolab Food Safety Specialties, providing food safety expertise to their national clients and writing for national trade publications. She has been a technical consultant and trainer for the National Environmental Health Association and currently assists Massachusetts regulators and industry in their FDA 2013 Food Code Adoption Project. Cindy has been instrumental in developing food safety control programs for a Massachusetts medical marijuana producer since the state legalized its use in 2012. Cindy, I'll go ahead and turn it over to you.
Thank you, Elizabeth. So based on what we've just heard, I think we can agree that there are a lot of potential risks around marijuana-infused edibles and a lot of questions actually on the part of regulators as to whether the products in their jurisdictions are safe, whether they're for recreational or medicinal use. And so given all of this, it makes sense to look at marijuana-infused products and edibles just as we would any other food product and consider the risks of the raw materials, the hazards that can potentially occur during the production process of the food item, and of course security concerns are on top of all of that. And for medicinal applications, food safety is especially critical since an immunocompromised population is often the consumer of these foods to ease their symptoms of chronic or acute disease. Part of the concern comes with the fact that MIPs, or marijuana-infused products, are largely unregulated in many states that allow them for recreational or medicinal use. There are wide ranges of regulations, variation from state to state. Some states have developed their own regulations, and questions still exist. Should they be following FDA manufacturing regs or the retail food code or state regulations for retail operations? What about allergen declarations? A lot of states that are continuing to adopt these regulations have questions hanging over their heads. As Mark mentioned earlier, Massachusetts has a vertical model, a vertical system for marijuana-infused edibles. I've been working with an edibles producer in Massachusetts for the last 5 years or so, and the medical marijuana program in Massachusetts has some specific requirements in the regulations for the production process and control measures that need to be implemented within a facility. And as Mark mentioned, also the registered marijuana distributor is one and the same from seed to sale. They are the grower, the producer of the product. The distributor and the dispensary retail operation also belongs to them as well. The products that result are not considered either foods or drugs, and there are dedicated inspectors, at least in Massachusetts, for inspecting marijuana-infused products, and they do have strict requirements in Massachusetts regs from seed to sale. Regardless of which state you're in or the regulations that states are following for these products, it makes sense to look at edibles just as we would any other food item and perhaps develop a food safety plan for these products with a hazard-based approach from seed to sale. The goal, of course, is to ensure the safety of the process at every step, to identify hazards and preventive controls that can be applied at every step of the process, as well as standard operating procedures, and then actually implement these control measures and monitor the activities of the grower, the producer, the distributor. The first step would be to draft a flow of food, and here's a very simplified diagram of the flow of food from growing to distributing the food products. Just as in a traditional hazard plan or a food safety plan, we would then want to do a hazard analysis of the products at every step and identify the hazards. I've just listed a number of them here. I'm not going to go into too much detail in the interest of time. Plus, Mark and Marlene have already covered these hazards that we want to keep in mind as we're moving ahead with the production process. And on top of this, we have security issues in packaging, storage, transport, and distribution, which actually adds a whole nother level of concerns that regulators may have to be concerned with. Once we've identified the hazards at every step, we can identify critical control points, steps where it's essential that we put specific control measures in place before we can move ahead to the next step, just as we would do in a traditional HACCP plan. In addition to control measures, these critical control points, ideally there would be a whole host of standard operating procedures written to address risks throughout the facility, in the cultivation stage, cannabinoids extraction, food safety procedures, covering sanitation, packaging, record keeping, and security protocols. I'd like to discuss some best practices that can be included in these SOPs and implemented for a safe and secure edibles program. First, in the growing stages, briefly, the cultivation should be done in highly secure areas with limited restrictions to authorized personnel. And it's recommended that pesticides be organic according to USDA requirements. Contaminants limited for mold, pathogens, pests, toxins. Soil should meet federal limits for toxicity, just as in residential standards. And as Marc mentioned, all of these above would ideally be verified through lab testing during the cultivation stage. Once the plants are grown, it's important to safely store the plant materials with strict environmental controls, good lighting, ventilation, controlled temperature, and humidity. Pest control programs should also be put in place with no insects, rodents, birds, and of course clean and orderly storage conditions. There are different methods for extraction of the cannabinoids, as we've heard earlier, either with solvents to extract active ingredients, or an ice method or a heat method where no solvents are used. The concern is to ensure the safety of the extraction method, both for the integrity of the active ingredient that results and for the safety of the employees during the extraction process. The goal is to ensure that the extracted substance is a food-grade ingredient. If a company is using a solvent extraction method, the chemical process should comply with FDA and state requirements, the solvents and processing aids for purity and safety, with proper ventilation, meeting fire safety building codes, and preferable to have a closed-loop gas extraction system. Once the extract is obtained, testing should be done of the substance for the different contaminants and cannabinoid profiles. And then if the test results pass the state requirements or minimal limits, this extract could be considered a food-grade ingredient, and then we continue on with food production. Sometimes the extracts are infused into an anaerobic medium or hash oils before being added to foods. There may be some concern about Clostridium botulinum outgrowth and toxin production in this anaerobic environment, and I'm not going to go into too much detail here, but control measures would be applied just as in any other anaerobic food product that could have a potential Clostridium risk, botulism risk, that is. Also, once we've considered the extract to be a food-grade ingredient, it can be added to the foods in production, whether it's the oil, the cannabinoid oils, or the plant materials, and standard operating procedures could be applied just as in any food being processed. Personal hygiene practices, contamination preventions, time and temperature controls, if it's a TCS food, illness policies, cleaning and sanitation, just as in any other typical food item in manufacturing. And then again, we have our final product. Before packaging, it should be tested for microbials, mycotoxins, pathogens, possibly shelf life testing for quality could be done for non-TCS products, such as candies, brownies, cookies, and shelf life testing for safety would be recommended for any TCS or perishable foods. Packaging controls should also be put in place. Recommended that packaging materials meet FDA guidelines and food-grade materials are being used. It's also best practices would include plain, tamper-proof, child-proof containers with no images other than the logo of the producer. And packaging should not bear any resemblance to a commercial candy or product. Labeling would preferably include contact information of the producer, batch numbers, identifying codes for traceback purposes, and an allergen statement according to FALCPA guidelines. Consumer warning statements would also be good practice, advising consumers not to drive or operate machinery, keep children away from these products, and also a disclaimer that the product is not analyzed or approved by the FDA. Should have protocols for disposing of waste, both solid waste and liquid waste, and records should be kept for any waste disposal, and records kept for 2 years. Record keeping is also important to document procedures from seed to sale, starting with standard operating procedures, inventory records, business records, waste disposal. Security issues are very important in these types of products. There should be no authorized entrance into the food production areas. Finished products should be kept in a locked vault before distribution with written emergency procedures in case of theft or loss of the product. And once the product is loaded onto delivery vehicles, the transportation to the dispensaries need to be controlled with secure vehicles and authorized persons present at all points in the process. And finally, training is extremely important. Just as in any food service operation, training should be appropriate to the tasks of the workers. Food manager certification or food handler training, HACCP training for managers, and training on confidentiality and security issues. And of course, the growers need specific training on growing protocols and testing requirements. And having a food safety plan and best practices in place can be a lot of work, but it would help mitigate a lot of concerns and allow edibles to be safely enjoyed and benefit the millions of persons who especially need them for medical relief. So thank you, Elizabeth. I'll throw it back to you.
Wonderful. Thank you, Cindy. And thank you to all our speakers today. It's really been a fantastic overview of the current work being done within the world of edibles, and the feedback I've been receiving is really fantastic and lots of questions. So we're coming up on the hour here. If you can give me just 2 more minutes of your time, I want to let everyone know that we've received a lot of questions. We're not going to be able to get to them. So we will answer all your questions. We'll make sure that the speakers address your questions and get those out to you within probably the next few days to a week here. The webinar has been recorded, so everybody will receive a copy of the webinar as well. So keep an eye out for that. And then also want to let everyone know, if you're interested in learning more about this topic, and it sounds like there's a definite interest, we hope to see you at NEHA's annual education conference. It's in Grand Rapids, Michigan. It's July 10th through the 13th. We have a really fantastic panel scheduled, which will include 2 states, Colorado and Michigan, regulators who will be talking. We have an attorney that's going to be there, somebody from a lab that's going to be speaking, as well as an edibles producer to talk about how they ensure their product is safe for consumption. It's going to be a really awesome session with lots of time set aside to address questions. I think we have a good 60 minutes or so set aside just for questions from the audience. So we hope to see you there. Let's see. Yeah, I just want to thank our speakers again, to Marc and Marlene and Cindy. Thank all of you for being on the call today and all of your great questions. Again, we will get those out to you as soon as we can. And then also, when you disconnect from this webinar, there will be a very brief survey afterward, and we hope that you'll take the time to answer those questions. Those questions are really important for us to know what you all are looking for webinar topics, and we'd appreciate your feedback there. So again, the archived version will be sent out shortly. You can reach out to me. I did put my information in the chat box, so everyone should have that. I'm Elizabeth Landine with NEHA. Email address is elandine@neha.org. So feel free to contact me directly with any questions. Otherwise, thanks so much, everyone, for taking the time today and for joining us on the webinar, and have a great day.